I'm Dr. Katie Bourbeau. This week's Practice Essentials focuses on how to best care for newly diagnosed diabetics. Diabetes is one of the most common chronic conditions in the United States, affecting more than 1 in 10 Californians. In many low-income areas, patients with diabetes are especially challenging to manage. The Centers for Disease Control and Prevention recognizes how social determinants of health affect medical management of these patients. The 5 areas of social determinants of health include economic stability, education access and quality, healthcare access and quality, neighborhood and environment, and social and community context. Without accurately recognizing one's needs outside of the medical office, physicians become frequently frustrated when a patient is unable to control their diabetes. So how can we, as primary care physicians, address their social determinants of health needs while properly managing chronic illnesses like diabetes? The best technique I employ is motivational interviewing as an aid to the shared decision-making process. Motivational interviewing can decrease a physician's frustration with non-compliant patients while assessing their readiness for change. Motivational interviewing is a communication style that includes intent listening and open-ended questions. When performed correctly, a patient should actually spend more time speaking than the doctor. Our job is to direct questions in a manner that enables the patient and physician to reach a plan together which will succeed. By focusing on the patient's own goals, the patient and physician working together can build a trusting partnership and form an effective plan. I ask my patients, on a scale of 0 to 10, how ready are you to change? If they say a 3, I ask my patient, why not a 2? Do not hesitate to explore where the patient is in their health journey. You might be surprised to learn that a patient cannot afford to get to their appointments, and they're worried that their newly diagnosed diabetes will cost them their job. Or perhaps your patient just won the custody of a child and is learning a new routine at home and is worried about taking medication several times a day. With practice, any primary care physician can become an effective and adept motivational interviewer. Consider beginning by using language appropriate to the patient's background, showing compassion, recognizing and affirming the patient's past efforts, summarizing where you believe the patient is in terms of readiness, and using their own comments to direct them toward a common goal. Once you've taken time to better understand your patient's readiness and ability to change, develop a personalized care plan together. With a strong patient-centered primary care team, we can help our patients succeed at managing their diabetes and other chronic illnesses. Thank you.